Welcome ECPI faculty. This presentation on using video in answering discussion questions is prepared by the RN to BSN program for your viewing pleasure. There are many challenges to the online and in-seat classroom. Observation of professional behaviors allows for feedback and evaluation of program outcomes. Evaluation of student learning outcomes that measure the performance objectives can be done either through live webcam observation or through a videotaped observation. The RN to BSN program student learning outcome is communicate with patients, families, and healthcare providers to coordinate care and advocate for vulnerable populations across healthcare settings. The Nursing 380 course student learning outcome is this: practice clinical judgment and clinical reasoning in a variety of complex nursing and healthcare situations, resulting in database decisions. In week 4, one of the student learning objectives is to be able to communicate bad news in an empathetic manner. So after reviewing the best practices for communicating bad news with a patient or a family member, students write a script based on a past personal experience and then videotape their scenario, following the best practices they've just learned. The script and the link to the video from YouTube is placed as a reply to the discussion question in the Moodle classroom. Students then provide feedback and discuss the techniques used in the video. Let's watch one student video on delivering bad news to a patient. Remember, these are students in the learning process and are not famous speakers or licensed counselors.
Hi, Miss Jones. It's my understanding that you were going to get to go home today if your vancomycin levels came back within a normal range. Was that your understanding? Well, unfortunately, that is what I came to talk to you about. I received your levels back today, and they weren't within normal range. They were actually a little bit high. Unfortunately, this means we need to keep you for some continued focus monitoring until we can get your levels back into a safe discharge range. They're too high to discharge you home safely, especially when you'll be continuing the antibiotics at home. It's really important that your levels are stable before you receive that next dose. I'm sorry this isn't the results that we were expecting. Sometimes our body's reaction to medications is not always something we can predict or control. Let's not give up here, Miss Jones. Although it is a setback, it's a temporary one. We'll make all the adjustments that we need to get your levels back where they need to be so that you can discharge home safely. I'm going to follow up with you with your new set of orders, and I will check in with you often to let you know the progress that you're making and answer any questions that you may have. We will get through this. Do you have any questions currently, Miss Jones? Okay. Well, if any questions arise, you make sure that you let me know what they are, and we'll work closely together until we get you home safely. Thank you, Miss Jones, for your time.
In week 4 discussion, this question had over 50 replies from just 8 students in the class. It was one of the most discussed questions in the whole course. Here are other learning outcomes. Students achieved the unit, course, and program learning outcomes. They demonstrated best practices, they received constructive and supportive feedback, and they learned new technology skills. This learning activity can be used with in-seat or online students. It can be used with students with little technology skill or a lot of technology skills. The equipment you'll need is a web camera and a computer. If you'd like more information on how to put together a quick animation for a course review, student updates, daily reminders for students, go to the GoAnimate site for a quick video tutorial.